Starting this week, face mask requirements on public transport have been lifted here in Korea after more than 2 years of a tough mandate that sought to keep COVID-19 at bay. So what is the current COVID-19 situation here on the local front? What is the broader public response to the latest ease in COVID-19 related restrictions? And what can be done to ensure a stable new normal amid COVID-19? Welcome to Issues and Insiders. Today, we address the latest efforts by health authorities here in the country to embrace a new normal of life amid COVID-19. For this, I have Dr. Kim Seung-taek from Institut Pasteur Korea. Dr. Kim, it's been a while. Welcome back.
Good afternoon.
I also have Dr. Alice Tan at MizMedi Women's Hospital live on the line. Dr. Tan, as always, it's a pleasure to have you with us.
Thank you for having me.
Dr. Kim, let's begin with an assessment, perhaps, of Korea's current COVID-19 situation then.
Well, I think generally what we are seeing is very steady and then steady but very slowly, just a decline, just the phase. So if you look at some numbers, when I just compared the number of just the daily new cases, we are seeing now just less than 10,000 cases per day. But in the earlier this year, in the January, we saw like more than 60,000. It's slowly but steadily we are actually the decline in the number of just the new cases. And also if we look at the daily new death, the same period we saw like about just 60 deaths per day, but now we are seeing about just 10 deaths per day. So the situation is very pretty much just improving just day by day. And then most of the main reason for this declining phase is our just changing immune status, whether it was due to by the natural infection or just the vaccination. And if we keep just our immunity just very strong, then we will just keep this phase, or maybe even just more just declining just the phase of this COVID-19.
Right, I see. And Dr. Kim, then, what are your thoughts with regard to the latest lifting of indoor face masks at public transportation?
Well, I thought it's just a matter of time because already several foreign countries already lifted such kind of mandate in even just the public transportation. Although this mask wearing is kind of the final last layer of just protection in terms of the public health. But then now every core of the mandate is now just shifting to the personal responsibility and then choice. And even just yesterday and then today, when I rode on some subway in the bus, still most of the people are just wearing masks because now people are just aware of the some importance and then how just functional those wearing masks actually just protect themselves. And then also that we have some pretty good now maybe just the government just maybe confident that we have enough supply of just vaccines and then some drugs available. So if there's any unfortunate situation, we can actually just we can actually just address such kind of the situation very efficiently right now.
Right, that is good to know. Dr. Dan, the World Health Organization has asserted that COVID-19 will cease to be a public health emergency of international concern within this year. What are the implications of that particular assertion, do you think?
Yeah, so on March 18th, as you said, the DG of the WHO, Dr. Ghebreyesus, predicted that the pandemic would be over sometime this year. And this is the first time that we've heard such a positive prediction from the WHO. But he did remind everyone that it's not quite over yet. The previous week, there had been more than 5,000 deaths reported due to COVID-19. And he remarked that these were deaths that were probably preventable with vaccines and treatments. The implication is that we are now moving from an intra-pandemic phase to an inter-pandemic mode. In other words, not only are we having to concentrate on protecting those who are still vulnerable right now, but we should also be shifting our attention more towards having a plan in place to prevent and protect against the next pandemic. And the other implication is that we do have strong evidence that our countermeasures do work. They still do work. It's just a matter of implementation and making sure that people use them correctly. And so we're in this mode now, I think, that's transitional. We have to both protect, but then also prevent and prepare for the next pandemic.
Right, of course. Dr. Dan, staying with the global health body, I believe it has recently reiterated its call on China to be more transparent in sharing information regarding COVID-19. Do you care to explain this latest call for us?
Right, it's a very intriguing story that's unfolding, and I feel like we're getting bits of evidence from an unsolved mystery. Basically, there were hundreds of samples that were taken from the Huanan seafood market back in January of 2020 through March of 2020, when the pandemic first broke out in Wuhan. And initially, all of the samples that were derived from animals from the market were negative for evidence of the SARS-CoV-2 virus. But after metagenomic information was derived, it was found that there was evidence of 3 animals that could be potential leads in terms of finding intermediate hosts for the SARS-CoV-2 virus. And this is all new information. Also, a bit of new information was that the Huanan seafood market was not the only market that had positive samples. There were some other markets, 2 other markets in Wuhan that might have had positive PCR for SARS-CoV-2. And the issue is this genomic information was raised on the GSED website. This is an international website that collects this genetic information data. And scientists noticed this in the beginning of March. But then the information was, for some reason, it was removed from the website. And so there are a lot of questions now that are being asked of the Chinese CDC. Why was the information taken down from the website? Do we have information about the upstream sources of the 3 animals that were not identified initially? They are the wild raccoon dog. There was also Malaysian porcupine and bamboo rat. Do we know where these animals came from? And then do we know more information about the other markets that had positive samples? So a lot more questions are now being asked. And Dr. Ryan of the WHO said it's like putting together pieces of a jigsaw puzzle to try to get a clearer picture as to the origins of the pandemic.
Right, I see. Meanwhile, Dr. Kim, moving forward, as you mentioned earlier, immunity is very important as we seek this new normal amid COVID-19. What can you tell us about the length of protection offered by hybrid immunity that includes protection induced by both infection as well as vaccination?
Well, for the protection, we have to actually distinguish whether we are actually protecting from the infection or protecting from the severe deaths and the hospitalization and also just the death. So for the infection itself, whether it is hybrid immunity or whatever it is, the level of antibody levels does not actually just stay very long time. So what it is known for now is like 2 or 3 months after infection or like just vaccination, antibody levels will just decline. So what it means that we are again just could be vulnerable to this reinfection. So for preventing such the infection, we need a very ideally just a frequent just vaccination to just maintain the higher level of just antibodies. But in order, well, for the in terms of protecting from the severe disease, all the data so far the way we have obtained is that the best protection is that actually we can obtain by just 2 means. One is 3-shot. The vaccination series, and then the other one is well, maybe 2-shot and then infection. And then now we have actually, well, before just the Omicron, just the emergence of Omicron variant, the scientists actually just examined, and then maybe 2-shot maybe just enough in terms of protecting from severe diseases. But since the emergence of Omicron, now what we observed is the 3-shot, at least just a primary shot series. The first 2-shot and then the 3rd shot is important for protecting in this case, as Omicron variant. So since the Omicron variant, now we actually just almost now just 1 year actually just elapsed, and then but so far this 3-shot or just the 2-shot and then infection, still in terms of protecting just a severe disease is still pretty good. But we do not know just any long-term just projection because we have no one actually ever experienced such a thing. So as of now, that's the thing that I can tell about just the longevity of our just vaccination and the infection.
This is also an impromptu question then, Dr. Kim. What can you tell us about the level of protection offered by hybrid immunity? Is it stronger than vaccination or infection, like protection induced by vaccination or infection, of course?
Well, that's just a matter of just a scientific question. I don't have any just a clear answer to that question, but that is an interesting one.
Right, it really is. People are talking about it, I suppose. Dr. Dan, as we mentioned earlier at the start of this session, starting on this past Monday, that would be, face masks are no longer required on public transportation. Masks right now here in Korea are now only required within medical facilities and nursing homes. When do you suppose will mask requirements at these particular venues be lifted?
You know, I'm finding myself wondering whether or not perhaps wearing, universal masking in these kinds of facilities might not become the new normal. And the reason why is because even though the situation is much improved, both domestically and around the world in terms of COVID-19, the daily 7-day average of COVID deaths is now less than 10 per day. The average 7-day average daily number of new admissions is less than 50. But still, we know that hospitals in South Korea can be very crowded. And of course, this is where the most vulnerable people to severe disease and death due to COVID-19 congregate. This is where people go to get their chronic diseases treated. And then, of course, in the long-term care facilities, that's where people who are elderly are in a congregate setting as well. So if we were to extrapolate the current level of deaths, about 10 deaths per day, that would mean after a year, we would have almost 3,000 deaths. Now, for comparison, in 2020, there were 3,081 deaths due to motor vehicle accidents, so traffic accidents in South Korea. Yet we don't say, oh, now we can, everyone can take their seatbelts off when they get in the car. So I'm wondering if perhaps this might not be the new normal in healthcare facilities and in residential long-term care facilities for the elderly, just another level of protection.
Right, a very viable thought, of course, especially given our current situation. Dr. Kim, do you believe efforts should be made to encourage further public vaccination especially among the vulnerable, as we seek this new normal?
Right. Well, for the vulnerable people, well, maybe we might just we had better just encourage just a vaccination. Well, I don't know how just practical this is, but maybe twice a year, something like that. But then also, if I have to just pick one specific time, maybe just the winter season, because winter season is, well, COVID-19 is, COVID-19 is all around, just all year round. But then we're actually concerned about potential just a co-infection. And the co-infection sometimes very exacerbate the disease just outcome. So we might just think about just just a vaccination, especially in preparation of the winter, the flu season. And for these vulnerable people, but the vaccination is probably number one, just the method we can actually protect those people, but we cannot just guarantee just 100% protection, even if there's the vaccination and the wearing mask. But in that case, we have a very effective treatment option. So the good thing is that every vulnerable people, actually, they have to prepare for their own plans. What if they are just infected, even after extensive efforts of vaccination and mask wearing and just avoiding just a crowded place? So they have to plan ahead, and then if they are just got infected, they need to just move fast, whether they are really just test positive, and then the test turns out to be positive, then get the treatment as soon as possible. So that's the actually best way to go.
Right, you're very prompt with your recovery efforts, with your treatment efforts, that would be. Dr. Dan, also on the vaccination front, what do you recommend with regard to its timing and perhaps frequency?
Right, so this is a big question, and I don't know that we have any clear answers. We do know that in the US, the bivalent vaccine was introduced in September. And so this is going on the 6-month now time frame in terms of post-bivalent vaccination. And the US FDA, they had a meeting discussing what the plan would be for boosters going forward, and they seem to lean towards a yearly booster for COVID-19. However, in the UK, they did announce a plan for rolling out a spring booster for the COVID-19 vaccines, and they will be starting in Scotland at the end of this month, so end of March, and then rolling out the booster to the rest of the UK over April. And so they are deciding to target the high-risk groups. So anyone 75 or older, anyone age of 5 years or older who has immunosuppression, any elderly person living in a group care home, they are all eligible for receiving a second booster. And they are using not just the bivalent mRNA vaccines, they're also using protein subunit vaccines for their spring booster. And so it seems like the UK is going for a twice-a-year approach for a COVID-19 vaccine. But of course, this is all new territory, and we'll have to see what Korea decides. Now, here in Korea, we should note that during the second week of March, it was noted that there was about a 16% increase in the number of new critically ill patients with COVID-19. And so we do know that the bivalent vaccine, in terms of peak effectiveness, that's reached at 4 weeks. And thereafter, protection does seem to wane. And so we do need to think about what our next step should be.
Right. Dr. Kim, aside from face masks indoors, that would be at nursing homes and medical centres, the only other pandemic-related guideline that we have in place here in the country is the 7-day isolation period for COVID-19 patients. What conditions do you believe need to be met before we can lift this particular restriction?
Well, this 7-day just isolation should be lifted because just in case of just flu, we do not just quarantine the infected people. But then I think the government actually just looking and waiting and just see the probably upcoming decisions by the WHO, and then they will actually discuss whether they would just lift it or just change it, just current as a public health emergency of international concern. And that's maybe the government will actually look into the some global just a movement, and also some domestic situation, whether our just current situation, whether it is which is just actually declining and a very just steady level, will actually continue. And that those are very just probably just the main criteria by which they will decide.
Right, hopefully. Dr. Dan, efforts are underway to devise a comprehensive response strategy against future pandemics. What do you advise with regard to these efforts?
Right. The fact that we're now beyond 3 years of the pandemic and we're still talking about it means that whatever we did for COVID-19 pandemic, we could have done better. And so experts are now convening, and they're coming up with plans for what we need to do. And one of the expert groups has recommended that we need to come up with a plan that is equitable, sustainable, and also effective. And one of the key components of that is coming up with a financial mechanism that will help support all of the development and the countermeasures that need to be in place. And they noted that the COVAX facility, as optimistic and wonderful as it sounded in the beginning, it really crumbled against the forces of the market economy. And so we need to come up with a financing mechanism that treats countermeasures, pandemic countermeasures, as a common good. We have to think about having an approach to developing the science of new countermeasures that treats them as a common good. It's not something that can be just left up to the free economy. Of course, we need to come up, I think, also with a pan-coronavirus, and so we need funding and effort into developing vaccines, and then surveillance, of course, is going to be very important because we've noticed that the pace, the interval between pandemics seems to be decreasing, and so we need to have maybe candidates vaccines and treatment candidates on the shelf ready to roll just in case another pathogen with pandemic potential emerges onto our screen. Whatever we do, it needs to be better than what we did this last time.
Right, and hopefully that will be the case. And against that background, Dr. Kim, against those broader and more ambitious plans that we need to put into practice against future pandemics, what can members of the general public here in the country do to ensure health as we embrace this new normal?
Well, I think in terms of just the public health, well, I want to just actually emphasize the personal hygiene. Because even just before just the COVID-19 pandemic, just infectious disease specialists strongly just recommend the wearing mask, especially for the flu season, and also just washing hands. Those are very proven and effective just the means to prevent the transmission. And also maybe in Korea it's not really well, there is not much chance, but there are some countries like some southern China and then Southeastern Asia, and there is some area that whether it's a very just the deforestation and urbanization is just occurring. So that's kind of just a contact point between the urbanization and deforestation. That's the point where the sort of the zoonotic viruses, which is the novel, just emerging viruses is actually coming out, including now just SARS-CoV-2 and then MERS and also SARS-1 and then other Ebola. And there are mostly just most of the new the emerging viruses actually coming out from the sort of just interface between the human living area and then just wildlife, just a living area. So the point is that just to try to avoid just the contact with the wild animal. That's kind of a thing just in terms of just a personal, in the public, the health point. But then since you asked about some efforts for some device comprehensive response strategy, so maybe I can just add some more just information, my information. Well, the interesting thing is that based on our experience, maybe for the last 3 years, in one way, maybe the people are, when the government actually not successful, but some other ways are successful. One of the things that I want to just mention is the development of vaccines. Well, the vaccine was actually successfully developed within, I think, just 10 months after reporting the SARS-CoV-2 as a causative agent of COVID-19. That was just a huge success because normally vaccine development cannot be accomplished such a short period of time.
Normally, how long does it take? About 10 years?
At least some several years. At least several years. There's some very just variation. Even some vaccines, like some vaccines against the hepatitis C and then vaccines against the HIV, have never been developed yet successfully, even after decades of efforts. So it actually depends on the pathogen. And so now just U.S. government and others now just thinking about sort of just a 100-day mission. 3 years ago, now they just finished within just 1 year, or developing and then distribute those vaccines to the general public. But now just the government and the international body thinking about just a 100-day mission. And then they even just short the development process. That's the one thing. And then in terms of maybe some other development, maybe vaccines, the scientists are thinking about some new platform technology, which is actually just addressed very quickly like this new emerging pathogen. So for example, now we can say now at least mRNA technology seems to work very well. And for the treatment options, as Dr. Dan said, maybe you are thinking about some sort of just a broad spectrum antivirus.
Right,
although specificity is low, may be effective against many different kinds of viruses.
Right. All right then, Dr. Kim, as always, thank you very much for your time and your thoughts. And Dr. Dan, thank you so much for your insights today.
Thank you.
Right, well, that is all the time we have for this edition of Issues and Insiders. We return same time tomorrow. That is Wednesday. Join us then.